Welcome to the Deep Dive, the show dedicated to unlocking the most potent insights from the sources you need. Today we're kicking off with C.G. Jung's profound statement. Until you make the unconscious conscious, it will direct your life and you will call it fate.
That's a powerful idea, isn't it? Really sets the stage.
It really does.
Yeah.
And this deep dive is crafted specifically for you, our future counselors and psychology practitioners. Our mission today is to really get into the insight stage of helping skills, drawing heavily from Clara E. Hill's helping skills.
Indeed. We'll be walking you through the theories, the skills, the whole process, step by step.
Right.
Our goal is to equip you with a clear, practical understanding. How do you guide clients beyond just surface-level stuff to real self-awareness, new perspectives, and, well, ultimately meaningful change?
Think of it as a shortcut, maybe, to mastering the why behind human behavior.
Exactly. With real-world examples, hopefully, to bring it all to life for your practice.
Okay, so to set the scene for this journey, let's maybe talk about Kioma. She's a 21-year-old African-American woman, and she's really grappling with depression and anxiety. Her parents are pushing her towards medicine, a path she really doesn't want. But, she feels trapped. Her family's culture emphasizes harmony, so it's incredibly hard for her to voice her own desires.
That's a tough spot.
Yeah, and she's turned to heavy drinking to cope. And even though she has friends, she feels profoundly alone, misunderstood.
And there's the immigration piece, too, right, from Nigeria.
Exactly. She experienced bullying after immigrating, tried to connect with a white girl who, unfortunately, also kind of belittled her. So Pioma lost her sense of self just trying to fit in.
Which probably explains why, when she first met her helper, she was quite hostile.
Right, displacing those feelings onto the therapist, feelings she really held towards others who'd hurt her.
Yeah, and what really stands out in Kioma's case, I think, is how her helper carefully fostered exploration first. Looking at her cultural background, the huge difficulties of immigrating.
That foundation seems key.
Absolutely critical for the insight stage to even happen. Through that work, Kioma started realizing her deep loneliness stemmed from feeling, well, fundamentally different from her friends, always having to adapt.
And addressing the trust in the therapy room.
Crucial. That allowed Kioma to eventually open up, to confront and understand the patterns in her other relationships. It really shows that dynamic journey through insight.
It's a really poignant example. Now, for those of you who've been following along, the exploration stage, which comes before insight, is all about building that trust, right? Creating a safe space for clients to tell their stories, feel their emotions. And sometimes, for some clients, that's actually enough. They find their agency, they start to heal.
True. But here's where it gets really interesting. Many clients don't just progress smoothly after exploration. They get stuck.
Stuck out.
Well, they might compartmentalize painful experiences, Makes it hard to connect the dots. Or they struggle to understand the origins, the consequences of their feelings. Or maybe they've just operated a certain way for so long it's become a blind spot.
Or they have wounds from the past.
Exactly. Deep wounds may be from caregivers, making it hard to see the world as safe or themselves as capable. Or sometimes they're just eager to learn, but they need that outside perspective, to shine a light on what they can't see themselves.
And this is where the insight stage becomes essential.
Precisely. It builds on that trust, that information gathered in exploration, moving past the defenses to help clients accept and understand themselves on a much deeper level.
Okay, so let's unpack this then. What exactly is insight and why is it so vital for our clients?
Well, when a client gains insight, it's not just about, getting new information. It's about seeing things from a completely new angle, making connections, understanding why things happen in their lives.
Okay.
And it's not always that sudden aha moment, although those definitely happen.
Like a light bulb turning on.
Yeah. Remember Yin Yin? She realized her intense anger at her boyfriend. He didn't want to go to a party. It actually stemmed from childhood stuff, rarely getting her way.
So it wasn't just the party.
No, it was about perceived past injustices, feeling powerless. That was her aha moment.
But you're saying it's not always like that.
Right. As Carl Rogers pointed out, often insight is much more gradual. It accumulates bit by bit, like gathering gold dust, he called it. It happens as people develop, the psychological strength to handle these new, sometimes uncomfortable perspectives. Think of Roberto, maybe. He might slowly realize his career indecision isn't just about jobs.
It's deeper.
Yeah, it relates to conflicts with his wife, his own identity in that relationship. but maybe that only comes out after several gentle challenges, interpretations over time.
This brings us to a really fundamental question, doesn't it? Why is understanding things so crucial for us as humans?
Well, Frank and Frank, who were influential researchers, suggested that the need to make sense of things is as basic as needing food or water.
Really? Fundamental.
Yeah. Wampold echoed this too. We inherently seek explanations to make sense of our lives, to predict what might happen next. It gives us a sense of coherence.
Okay.
And our existing assumptions about danger, safety, good, bad, they profoundly shape how we perceive things and how we act. So insight, in this view, is about kind of reworking the past.
Reworking the past.
By discovering new facts, new relationships between events, allowing for a more adaptive present.
So how does this core human need connect with some of the big theories in our field? Like Freud.
Yeah.
His work is often seen through a historical lens, but...
Right. But Freud actually believed that psychological problems are developmental, and resolving them requires insight into their origins. He thought symptoms often make perfect sense when you see them in the context of past experiences.
Can you give an example?
Sure. Think about Jenna. She had this profound fear of public speaking, seemed totally inexplicable, until she connected it to a deep-seated reluctance to, outshine her very passive mother. Her insight realizing she'd been unconsciously limiting herself, really, to placate her mother, that gave her the power to make new choices.
That makes sense. And then there's Viktor Frankl, too, right? His existential view.
Yes, Frankl emphasized finding meaning and purpose, even in profound suffering. His experiences in the concentration camps, just horrific, starkly showed that while he couldn't change his situation...
You can change the meaning.
Exactly. You could change the meaning he attached to it. And that, too, is a crucial form of insight. Ultimately, a client's interpretation of events directly influences their feelings, their behaviors.
So take John, the one hesitant to drive.
Right. If he thinks it's because a friend died in an accident, therapy might focus on fear, trauma.
Makes sense.
But if, through insight, he realizes it's actually about a reluctance to grow up, to leave his depressed mother...
Then the whole focus shifts.
Completely. Shifts to separation, individuation, those kinds of issues.
What's really impactful here, I think, is that insight often seems to come before effective action.
It often does.
By helping clients understand how they think about their problems, we're not just giving answers. We're teaching them a problem-solving approach they can use themselves, right?
Exactly. Like John, once he understands his reluctance to drive is tied to leaving his mother, then he can make an informed decision that aligns with his values, his desires, rather than being driven by some unconscious pattern.
This leads us to a really critical distinction you mentioned earlier: intellectual versus emotional insight.
Yes, huge distinction. For real, lasting change, insight needs to be both emotional and intellectual.
Okay, so intellectual insight is?
It's a purely cognitive understanding, an objective explanation, like saying, I am anxious because of my Oedipal conflict.
Referencing Freud's ideas about complex family dynamics.
Right, which, we interpret differently today, but it highlights how those early relationships shape adult anxieties. But just knowing that often feels, well, kind of barren. It doesn't necessarily lead to action.
It's like having a map, but never actually walking the streets.
That's a great analogy. You know the layout, but you haven't felt it. You haven't experienced it, so you can't really change your relationship with it.
Okay. So emotional insight is?
That connects the intellect with the raw, felt emotional experience. It creates a sense of deep personal involvement, responsibility.
Like nude.
Exactly. He realizes his conflict with his wife, she wants her own interests, stems from the deep hurt he felt over his father's absence. But it's not just knowing that.
He has to feel it.
He has to feel that specific hurt deeply, maybe for the first time. That connection between feeling and knowing lets him grieve, lets him see his wife more clearly, separate her from his past.
And that's what drives the motivation for change.
Precisely. And it requires active client involvement, a willingness to experience those emotions. It's not passive.
Okay. So with this understanding, how do we know? How do we know if a client is actually ready for this deeper dive into insight? Are there clear markers we should be listening for?
Absolutely. You'll often hear a client state they're aware of a problem, but then say they lack understanding, or they express a real eagerness to grasp something.
Or maybe high distress.
Yes, high affective distress.
Yeah.
That intense emotional pressure pushing them to resolve the issue is a strong indicator too. A ready client might say something like,
Or like?
I just don't understand why I get so angry at my boyfriend. He usually does nothing wrong. I really wish I understood it because it's making me miserable and it's about to destroy the best relationship I've ever had. You hear the desire for understanding there.
Right. And conversely, what about signs that a client might not be ready?
Well, that might look like someone telling their story in a very non-reflective way, just purely descriptive, or
Yeah.
constantly asking for direct advice, or blaming others.
Ah, the blame game.
Yeah. An unready client might say, "The problem is my partner. He needs to change. He just doesn't understand me." What would you suggest I tell him? See how they're focused outward, not inward.
Yeah, definitely. It's interesting, though. Some clients seem naturally more psychologically minded, don't they? Eager to probe their inner world, while others are maybe more interested in just exploring or solving the immediate problem.
True, but we have to be really careful not to stereotype here.
Crucially important, right?
Absolutely. Never assume, for instance, that clients from lower socioeconomic backgrounds aren't suited for introspection. They can definitely be taught to reflect more deeply.
And cultural sensitivity is key.
Paramount. Some cultures, like maybe some Asian or Hispanic cultures, might value action or group harmony over individual understanding. We have to respect those values.
So you don't force it.
Never force insight. You can educate clients about its potential value, and sometimes that's persuasive, but the client always leads. Always.
Okay, let's kind of zoom out again and connect this to the bigger picture. The theoretical foundations underpinning insight work. Psychoanalytic and existential lenses.
Right. So Freud. His theories, yeah, sometimes seen through that historical lens, but they offer, honestly, immense richness for understanding human complexity.
And you mentioned research supports this.
Yeah, modern research actually supports the efficacy of psychodynamic theory. And interestingly, the results often endure and even increase over time after therapy ends.
Wow, unlike some other approaches where effects might fade.
Exactly. It suggests it's not just about symptom reduction, it's about teaching clients a new, more adaptive way of being, lasting change.
That really highlights the potential impact. Could we briefly touch on some key psychodynamic constructs, maybe as metaphors?
Good way to think of them. Metaphors for human struggle.
Hmm.
You have the early developmental stages, oral, anal, latency, genital, and concepts like fixation, getting stuck, or regression, reverting to earlier coping. They offer clues about deep roots of current patterns.
And the id, ego, superego.
Yeah, the id is like our primitive urges, immediate gratification. Pure impulse. The ego is the negotiator, dealing with reality, delaying gratification. And the superego is our internalized morals, ideals, our conscience.
Like Maria struggling with her weight.
Perfect example. Her id wants the deliciousness now. Her superego scolds her with societal ideals, and her ego tries to find a compromise, maybe a small, healthy treat after a workout. It's a constant internal negotiation.
And consciousness levels, unconscious, pre-conscious, conscious.
Right, the vast unconscious, influencing most motivations without us realizing, the preconscious, accessible with effort, and the conscious, readily available.
And defense mechanisms, we all use them, right?
Absolutely. Unconscious methods for dealing with anxiety by denying or distorting reality. Normal, even healthy in moderation. Problematic when used heavily, rigidly.
Like Antonio with his marital problems.
Yeah, projecting his mother's traits onto his wife, displacing anger onto the dog, using denial, regression to avoid anxiety about his feelings towards his mother. They protect him, but at a huge cost to his relationships.
And modern psychodynamic thought has broadened this.
Definitely. It focuses more on the centrality of conflict. Competing wishes, fears, prohibitions leading to compromises that can be symptoms or creative solutions. And it includes attachment, bonding, mastery, plus acknowledging cultural influence.
Okay, that reframes it nicely.
Yeah.
How does attachment theory fit in here?
Attachment theory from John Bowlby is fundamental. It explains the infant's basic need for closeness to caregivers for security.
The secure haven and secure base.
Exactly. A consistent caregiver provides that secure haven, reducing anxiety, and from that secure base, infants feel safe to explore. When that's disrupted, caregiver unavailable, unresponsive kids develop insecurity, worry about relying on others.
And Ainsworth's patterns, secure, anxious, ambivalent, anxious, avoidant, they carry over into adulthood.
Precisely. They become these internal working models, blueprints for relationships. They help us predict what to expect, how to respond.
But there's hope for change.
Absolutely. That's Bowlby's crucial point. Change continues through the life cycle. Therapy can be a huge catalyst here. The therapist can become a new safe haven.
A place to maybe rewire those models.
In a sense, yes. Work towards more secure attachment patterns.
Okay, so beyond personal history, there's this other lens, existence itself. Let's dive into existential theory.
Right. Existential therapy, while also dynamic, focuses on inherent existential concerns as the primary source of anxiety, rather than just early experiences.
So it's not instead of early experiences, but a different primary focus.
Exactly. Freud thought innate drives caused anxiety, leading to defenses. Existentialists suggest it's these core concerns of existence that cause deep anxiety, which we then fight with defenses.
And what are those core concerns? There are four major ones.
Yes. First, death anxiety. Our awareness of mortality, often heightened during transitions or crises.
Okay.
Second, freedom. Knowing there's no inherent external structure, so we bear profound responsibility for our choices, our destiny, can be thrilling, but also anxiety-provoking. Think choosing a career.
Big choices, yeah.
Third, isolation. That inherent aloneness of being human versus our deep wish for connection. And finally, meaning in life. The fundamental need to construct our own sense of purpose.
And this shows up in all sorts of situations.
Absolutely. A student choosing a major, someone with terminal cancer reevaluating life, someone retiring, an Olympic medalist post-games, a transgender person exploring identity, all grappling with meaning, freedom, isolation, mortality in different ways.
And culture plays a big role here too, especially religion or spirituality.
Definitely. It shapes how these concerns are experienced and addressed. As helpers, we listen for these clues, help clients understand how these universal issues play out uniquely for them.
So the bigger goal of both psychodynamic and existential approaches isn't just symptom reduction.
No, it's much broader. It's about fostering psychological capacities, resources for a more authentic, fulfilling life.
Okay, so we've explored what insight is, the theories behind it. Now let's get practical. How do we actually do this in a session? What are the goals, the skills for this stage?
Right. First off, setting expectations is key. This work is deeper, often more challenging, so it helps to prepare the client.
How might you do that?
You might say something like, I think we've built a strong foundation, and maybe we're ready to go a little deeper now. Try to understand where some of these problems might have originated. This might mean I'll be a bit more challenging than before. How does that feel to you?
Checking in, getting buy-in.
Exactly. Preparing them for the shift.
Makes perfect sense. And there are three main goals in the insight stage.
That's right. First goal, challenge clients to foster awareness.
Awareness of what?
Of thoughts, behaviors that aren't serving them well, especially those hidden behind defenses they've built up over time. Awareness is often the first step towards insight.
Like helping Kioma see her hostility pattern.
Exactly. Helping her become aware of how that hostility towards the helper mirrored other relationships.
And the skills for that.
Things like challenging discrepancies between words and actions, maybe. Challenging specific thoughts. Using gentle humor sometimes. Strategic silence. Challenging their sense of responsibility. Pointing out nonverbal behaviors. Asking targeted questions.
Okay. Goal number 2.
Facilitate insight itself.
Getting to the why.
Right. Helping clients understand themselves at that deeper level, motivations, sources of pain or happiness, what holds them back. This needs immense empathy, compassion, and a tentative approach, not forcing it.
And the skills here.
Open questions and probes for insight. Directly asking clients to reflect on the why or how. Then, interpretation. Offering tentative explanations that go just slightly beyond where the client is currently.
Gently stretching their understanding.
Exactly. Often focusing on origins, early experiences, the archaeological dig, as it's sometimes called, and finally, disclosing insight.
The helper sharing something personal.
Yeah, sharing a personal insight that might resonate with the client's experience,
Yeah.
but always done carefully, relevantly, for the client's benefit.
So the overall aim here is really making the unconscious conscious.
Pretty much. Helping clients understand those deeper influences, maybe analyzing dreams, fantasies, slips of the tongue, and gaining more control over those defense mechanisms.
Okay. And the third main goal.
Process the therapeutic relationship through immediacy.
Using the therapy relationship itself as a tool.
Exactly. It becomes a living laboratory. The goal is for clients to gain awareness and insight into their interpersonal patterns by looking at how they interact with the helper, right there in the session.
The microcosm idea.
Yes. It offers immediate, real-time feedback. Learning that can then be generalized outside therapy.
And the skills for immediacy.
Open questions and probes for immediacy, asking directly about the here and now interaction, and immediacy itself, the helper directly addressing what's happening between them. Always gently, though. Empathy, compassion, tentativeness are key. It's powerful for breaking old patterns.
This brings up those key concepts, transference and countertransference, which seems central here.
Absolutely central to understanding that microcosm. Transference is when clients unconsciously replay unresolved issues from past relationships onto the therapist.
Like Kioma's initial hostility.
Perfect example. Reenacting feelings from past hurts onto the helper. It's a powerful tool for understanding those ingrained patterns.
In countertransference.
That's the helper's side, their own unresolved issues reacting to the client. If a helper had a needy parent, maybe they unconsciously indulge a client's neediness, or maybe they get overly detached.
So awareness is key for the therapist.
Crucial. Not suppressing it, but being aware of countertransference is essential for effective ethical therapy. And of course, both transference and countertransference are shaped by cultural factors, biases. Adds another layer.
Yeah, thinking about the relationship has evolved, hasn't it?
Yeah.
From Freud's blank screen idea
Right, the one-person psychology.
to now a two-person psychology.
Yes, recognizing that both therapist and client genuinely contribute to the relationship dynamic. It's interactive,
So the relationship itself is a mechanism for change.
a central one. By openly discussing what's happening between helper and client, we can work through problems, clarify distortions, model healthy interaction, and help clients generalize that learning.
And you draw on other theories here, too.
Yeah, attachment theory providing that environment where clients can become more securely attached, hopefully leading to healthier attachments outside. And existential theory listening for those core concerns manifesting in the relationship, helping clients understand them in the here and now.
Okay, so bringing it all together, what's the helper's role look like in this stage, and what are the key takeaways for our listeners?
Well, in the insight stage, helpers take a more active, collaborative role, occasionally offering tentative ideas, but always fostering the client's own sense of discovery.
They should try on the insights.
Exactly. Test them against their experience, not just passively accept them.
And important cautions for helpers.
Self-awareness about countertransference is huge. Making sure interventions are client-centered, not driven by our own stuff. That's paramount.
And if the client disagrees or gets defensive,
Be prepared for that. But don't just label it resistance, which can sound like blaming. See it as a signal. Maybe the client isn't ready. Maybe the interpretation was off. Adjust the approach. Try something different.
it definitely sounds like these insight skills, immediacy, challenges, interpretations are harder to master than exploration skill.
They generally are. They take years of practice, good supervision. But, and this is vital, exploration skills, attending, listening, restating, reflecting feelings. They remain absolutely essential after using an insight skill.
You cycle back.
Constantly.
Yeah.
Back and forth.
Mm-hmm.
You use an insight skill, then you use exploration skills to help the client delve deeper into that new awareness.
So what does the research confirm about this?
Well, research like Bauman and Hill's study on the Hill Dream Model's insight stage does confirm that specific interventions like interpretations, self-disclosures for insight, and probes for insight are effective ways for clients to gain insight, often more so than just paraphrasing.
But clients react differently.
Always. Every client is unique. They'll react differently. So flexibility, attunement, those are always key.
This deep dive into the insight stage really highlights its power, doesn't it?
Yeah.
Moving beyond the what to the profound why, transforming intellectual understanding into that deep emotional connection, and really laying the groundwork for lasting, meaningful change. Thank you for joining us on this journey exploring these crucial helping skills.
Yeah, skills that will hopefully shape your future practice. And maybe, as you reflect on your own path, consider this provocative thought. Can we ever truly understand another person without our own experiences, our own biases, inevitably shaping our perspective? It's a question worth pondering deeply as you hone your craft.
A profound thought indeed. Thank you for listening to The Deep Dive. We really hope this has provided valuable nuggets for your journey.